let's move on to this rehabilitative medicine, which can be studied in three aspects. One is physical therapy, the other is occupational therapy, and thirdly is athletic training. Here, we need to know who a physiotherapist is or who an occupational therapist is, right? A physical therapist, his main ambition or his goal is to restore the lost function. Say for example, a person who has been subject to an injury or a motor vehicle accident and who is unable to gain his sensory motor skills. So at that time you would resort to the aid of or a help of the physiotherapist. Whereas what happens in the case of an occupational therapist is like even before the development of the functions, so they give this education so that they help in the initiation and development of such skill sets. So that typically takes place especially with children who suffer from serious hereditary diseases like cerebral palsy or like underdeveloped brain development. So here we find like we are going to see the code sets with a PT, OT and an AT, which is the athletic training. So here what we can do is like we have various codes based on the initial evaluation and the re-evaluation. So either the PT, the OT and the athletic trainers, what they do is like they develop a plan of care. So with the patient's current state of injury or current state of development, they will have to develop a future plan of care or it's like the projected goal, what they are supposed to reach. So that they will have to develop it. So after a period of time, they will have to do something called as a re-evaluation. And in order for all of these services to be covered, the PT and the OT activities should be certified by a physician. So this certification will range from state to state. So normally there would be for every 3 months they would have to renew their certification for these PT or OT activities. So here the codes can be selected based on the time spent face to face and also upon the level of complexity, whether it is low, moderate or high. Okay, here there is a peculiar type of modalities that we need to understood here. One is a supervised modality, the other is a constant attendance modality. There are so many activities and modalities which can be classified. So one that requires a constant presence of the a physical therapist or an OT or the assistant, and in some cases it does not require the continued presence of the PT or the treating provider. So those we call them as supervised modalities. Say the application of ice packs, whether it is hot or cold ice packs, and say the application of like ultrasound. Okay, so what you need to know is like you need to know which are the supervised modalities and what are the things that require the presence of the treating provider. So the modalities that require the presence of treating provider are all timed modalities. That means the CPT code will have the time requirement, and we need to know the exact timing the services that are all performed, because while reporting we have a certain rule called as the 8-minute rule.